Good afternoon, everyone. Very warm welcome to our fourth webinar of this webinar series on risk communication that is being organized under PARC. Our speaker today, which I will introduce in a moment, is Professor Susana Viegas, and she will talk about using biomonitoring to improve risk communication in occupational health. Just to remind, as usual, this webinar is planned for 1 hour, including the presentation, and then we will have in the end a Q&A session. So I encourage everyone to leave your comments or questions during the presentation, and in the end, I will ask the questions for you to Susana. So I will now introduce our speaker, which I would like to thank a lot for being with us today. Susana Viegas is a professor and researcher at the Nova School of Public Health and a member of the Comprehensive Health Research Center. She's specialized in environmental and occupational health with a focus on how environmental exposures impact human health. Susana is involved in several research projects in international scientific bodies, including the European Chemicals Agency, the European Environmental Agency, the World Health Organization, and she has also been a visiting scientist in the International Agency for Research on Cancer since 2021. She's also has also extensively published scientific papers with over 200 scientific papers. Susana, thank you very much again for being with us here today, and I will pass on the floor to you now for your presentation.
Thank you so much, Christina, for the nice presentation and introduction. And hello, everyone. I hope you enjoy this webinar. I will start sharing my slides just to guide our conversation and discussion. Just bear with me a few seconds. So I think it's now the correct screen.
Yes.
Just okay, everything is fine. So hello again. Indeed, this it is. It's everything right. Thank you so much. Thank you, Christina. So the talk that I will give today is on biomonitoring and how to use it to improve risk communication in occupational health. And why we decide to propose this webinar and why I thought on this topic. Well, I have some experience in different industry sectors on communicating exposure data to workers, employers, and also to OSH managers. But I also recognize the challenge on using exposure data sets to communicate with different stakeholders and policy actors. It's not easy. It's not easy, has a lot of challenge, but it's possible to do it and use it, these kind of data sets in the best way possible. And I have been learning the process. So I think it started on 2000, and I started working on formaldehyde exposure assessment, also on different settings using different types of solvents, dust, antineoplastic drugs, mycotoxins, the previous projects on HBM4U, and also the ongoing occupational studies from PARC. So this accumulated experience allowed me to understand the difficulties, but also the challenge and the way to surpass some of those challenges. So the idea in this webinar is indeed to present how biomonitoring data can help us, colleagues, researchers, technicians that work in the occupational health, to use this data not as a clinical information, but as an exposure assessment tool that can support risk communication to workers, employers, and even policy actors. So why biomonitoring is important in occupational exposure assessment. So I believe this is not new. Everyone knows the advantage of using biomonitoring. But I guess the one that is most well known is the fact that we can consider the total burden of exposure coming from all the exposure routes that can happen in the occupational settings. We normally use air monitoring. Maybe is the one kind of exposure assessment tool that we have more experience for whom works in this kind of area. But indeed, air monitoring only captures the exposure that happens by inhalation and don't allow us to understand if other exposure routes such as dermal absorption or ingestion are having an important role in the overall exposure. So we know that have advantage, but it's still an underused exposure assessment tool. And in 2020, we write some ideas about this, the difficulties and challenges that we have on using biomonitoring for exposure assessment. And at that point in time, we identify some of the challenges that we need to surpass. And I think one of the challenges was how we use these data sets as an exposure assessment tool outside the clinical context and to better communicate exposure and also the risk. So we know also, and it is well described, the conditions or the kind of aspects that implies the use of biomonitoring. So substance that may be absorbed through the skin, oral exposure that may occur due to hand-to-mouth contact, substance of high biological persistence, such as metals and PFAS, for instance, carcinogens, mutagens, or substance toxic to reproduction. Of course, in this case, we want to know the much everything that we can about the total exposure. In some cases, air monitoring may be impossible or impractical. Also, when exposure control relies largely on the use of personal protective equipment, such as gloves or respiratory protection equipment, or even human behavior, when a specific task needs to be performed in a specific way. Also, when internal exposure may be modified by physical stress, the case of the co-exposure to heat, this can really imply high exposure, and also in the cases of accidental exposure. And all these, let us say, reasons or justifications for using biomonitoring was also very well presented on the occupational biomonitoring guidance documents prepared by the OECD, where me and other colleagues had the pleasure to work. And in this guidance, we identify some of the reasons for using biomonitoring and also how we could present this kind of data to communicate risk. So, but of course, we have ethical and practical issues to consider. Biomonitoring communication must respect confidentiality and informed participation. Workers should know what is being measured and how the results will be used and who can access them. So in your right side of the screen, you can see one of our sessions informing workers and employers how the biomonitoring data will be communicated to the different groups of workers. And of course, we were available for questions, provide some clarifications. And well, this, I think, it's a good way to proceed. Well, in general, there is a need of informed consent, privacy protection, transparency, fairness, responsible data use, and ethical oversight to protect participants, of course, and while allowing valuable health and environmental research. So the idea is to have a biomonitoring campaign that can serve workers, researchers, employers, providing important information that everyone can use in different ways. And I guess that if there is trust and transparency, this for sure will improve participation and the usefulness of future monitoring campaigns. And I think this is an important aspect. If it works well, if everyone is clarified about the objectives, aims of the biomonitoring campaign, it will be easier to engage people and, of course, develop future biomonitoring campaigns. And why biomonitoring communication matters and how to do it. So clear communication is essential, of course, so that results lead to prevention, not confusion of the participants. But there are clearly two types of communication that more or less I have already explained it. So we have an individual data communication, and that's why we need to engage workers, inform them about what we are going to collect, what is the information that we will have and how we will communicate. And this individual data communication should be provided directly to each worker in a confidential manner. And then there is the aggregated data communication. Combine data from a group of participants rather than showing individual results. This group or this data from a group of participants is provided to OSH managers and or employers. And here you can see in the right, it's a study that we developed in Portuguese bakeries, and the idea was to study exposure to mycotoxins. And in this case, we provide the individual results to each of workers, well, the worker that decide to participate in the project, of course, and then the aggregated data we provided to the company owners without any kind of information about specific workers, names, and other personal data, but they have an idea about each group of worker, what was the exposure related with the work that they developed. But maybe we can talk a bit more about this aggregated data communication, how we can do it. So the aggregated data communication can be easier if we use the similar exposure group approach to define whom to be sampled. I think this SEG approach is known by the occupational hygienists or industrial hygienists. It is something well described in this European norm 689 that is dedicated to the measurement of exposure by inhalation to chemical agencies and the strategy for testing compliance with occupational exposure limits. And in here, the idea is to identify groups of workers and have a sampling strategy that can be representative of the different groups of workers. So a definition that is included in this European norm is this one. So this approach is a sampling strategy where a group of workers have the same general exposure profile for a specific or several identified chemical agents of interest. Exposure profiles are temporal exposure patterns related to specific types of jobs or tasks. And this SEG concept is used for defining risk management measures and for testing compliance with occupational exposure limits. So this is the well-known definition, but what this entails, and we also mention it in the guidance that I mentioned previously. So this OECD guidance, and we try to use or to present this similar exposure group approach in the context of biomonitoring, not in the context of air monitoring, as it was presented by European norm, but in the context of biomonitoring. So it's a group of workers expected to have similar exposure patterns because they do similar work under similar conditions. And how we define these similar exposure groups? We will see that this entails that you spend some time with the workers, seeing what they are doing, how they are doing things, and why they do specific tasks in a specific manner, what are the kind of risk management measures in place, the duration and location of the exposure within the shift. Of course, if it is a workforce that is experienced, it's different from a workforce that start working in the last month. And of course, there are several variables that can influence exposure that in some way should be captured to help us define this SEG. And I can provide an example, maybe it's easier. So if I identify a group of workers and they all paint a specific surface, they are painters, but there are painters using a specific kind of paints that are used in outdoor surface. So these surfaces are exposed to the environment. These paints will need higher content, for instance, of chromate. for sure this is different, of the exposure to chromate will be different if the painters only use paints to be used indoors, where there are no these kind of constituents because the surfaces are not so exposed to the environmental conditions. So this kind of details of the activity, products that are used and so on, will help us to create this group of workers that in principle will have the same pattern of exposure. I think this is a good graphic of that. I found it in the internet, trying to have a picture that could describe well this concept. And as you can see, similar tasks, same materials, equipment used also the same work environment. These are the kind of factors that we need to know well, and because this will help us to make this group of workers. Then we making the group process, collecting exposure data, analyze and compare, and then we categorize the workers. So in the last row, we can see that 3 groups of workers were defined. These based on the kind of agents that these workers are exposed to, but we can use this grouping for one specific agent, trying to identify, for instance, a common agent that are all exposed to, but in different conditions, with different risk management measures in place, developing different tasks, and this for sure will imply different exposure pattern. But why we should use these SEGs? Well, SEGs are useful for communicating aggregated exposure data because it makes biomonitoring more efficient and improves interpretation at the group level. This is what we want. We want to use this data. Of course, it's important at the individual level, but we want to have information on the group level so we can use this information to communicate with OSH managers and employers and use it to understand exposure patterns and also identify priorities for intervention. So we can identify the group of workers that have high exposure, higher risk, and because of that, we need to intervene and implement first the risk management measures. So here in this graph, you can see the paper published by some colleagues that they use they measure particles to help them to create these similar exposure groups and after that try to define sampling protocols. So the idea was really to help them to understand what are the similar exposure groups in a specific company, and based on that, define the sampling strategy to follow. So, considering what I mentioned before, how we can combine the similar exposure group approach with biomonitoring risk assessment, communication, and also management. So first define the SEG using information on tasks, process, exposure routes, and control measures in place. So all the information that I mentioned before. For an occupational hygienist, this might be something very common when they are used to do this for air monitoring. So it's the same approach in this case. Then choose the biomarker, sampling timing, and analytical method considered appropriate. Of course, this implies the substance, toxicokinetics, and so on. So really here try to look for the more specific and sensitive biomarker. Then analyze, compare results with the relevant reference values. That can be a biological limit value, HPM guidance value, and do this for each similar exposure group. Use the findings to conclude on risk assessment, and of course, try to identify the SEG with high exposure and higher risk, and then communicate the results, guide the risk management actions, and prioritize. So the idea is to use the results on risk assessment by similar exposure group to communicate the results. Try to identify the kind of risk management measures that are needed. It might be that they are already some implemented. There is a need of additional risk management measures, or even to improve the ones that are in place but are not well used or not well implemented by workers. And then prioritize, define in which sec we need to act first, in which sec we need to implement additional risk management measures. So this is also a graphical presentation of what I have said. So, and what to communicate report. So each report should explain what was measured, why it was measured, and how the data were interpreted. It should also describe the sampling context, such as the job, the task, timing, and likely exposure sources. So there should be a description of the exposure scenario. A report should be provided to each worker with their individual results individually, and also to employers and OSH managers with exposure levels by sec. So individual data to worker directly, aggregated data to employers and OSH managers. And of course, when values are elevated, the report should state what follow-up will happen. Even for the individual worker, some information should be provided and on action that will be developed by the company in general. And it might be that some action individually might be developed, for instance, training, additional RPE or additional PPE in general, or changes that will be done in the workplace to reduce exposure if something or some level was higher than expected. So specific to workers, workers should have a report with their individual data, use plain language and avoid unnecessary technical terms, explain that biomonitoring reflects total internal exposure and not just one route or one source of exposure, make clear that a value above the benchmarker, well, an occupational exposure limit, a biological limit value, is not a diagnosis, but it may signal a need to review exposure control, so something needs to happen. And the feedback should be timely, so avoid long periods before the collection of the samples and the results. Be respectful and confidential. So it should be done in a proper moment and space. For managers. So managers usually need a SEG data summary. So all the data for each SEG that was identified in that specific company. Show whether the SEG is generally below the benchmark, so the reference value, where there are outliers and in which SEGs, and whether the pattern is changing over time. So if we have several biomonitoring campaigns, we can even see if in a specific SEG there was changes in the pattern of exposure and maybe related with specific change that happened in those workplaces or in the way that a specific task was performed, or even a chemical product that was changed and substituted by something that explains the change in the exposure. Translate the findings into actions such as process changes, engineering controls, hygiene measures, or PPE review. So these are all the things that can be presented as a possibility to reduce exposure where a specific SEG presents, for instance, high values or higher than the biological limit value. And the emphasis should be on prevention, of course, and continuous improvement to reduce exposure to chemicals. So presenting the data is very much depending on the taste of who is doing the work and presenting the results. But in general manner, visuals help. There are some formats that can really present the data in a way that everyone understands, easier and rapid way. Of course, if we present tables and charts, if we have a reference value, so who is seeing the values and the report can really understand the difference between the values that were measured and the reference value. And of course, if there is a short interpretation box beside the figure, helps readers understand the practical meaning of the data that they are having access. So now I will present some data, some examples from the research work developed in the scope of HVM4U project. Some of you for sure recognize this data because it's coming from publications of the project. The project HVM4U had two occupational studies. One was known as the chromates project, and the other one dedicated to e-waste management. And you will see some of the data and how it was presented and how this could be used as an example on how to communicate using biomonitoring data. So here is the HVM4U chromates project. This is data coming from total chromium measured in urine samples. Here you can see the segs that were identified in this project. So you have to consider that these segs were coming from different companies, from different member states involved in the study. But we could think that this could happen in one company where we had bed plating workers, paint applications with chromates, machining, and welding. So the idea was to identify these segs, and they all have potential exposure to chromium hexavalent. And here you can see that clearly the bed plating and the machining are the two similar exposure groups where the exposure is higher. So if we have to identify the similar exposure groups or the group of workers where we need to revise the risk management measures, these are the two groups of workers. And this was very, very interesting because when we used, of course, the same grouping of workers for the industrial hygiene samples, and in this case, wipe sampling, we understood also that the bed plating workers and the machining workers were the ones with the higher contamination in their hands. So we could see that besides inhalation, probably hand-to-mouth contact was having a role in the overall exposure that we measured in the urine samples. Here the data coming from also from the HVM4U, but here in the case of e-waste study. So here you can see that we also identify groups of workers dedicated to different types of waste that was being handled by workers. And we can see that the workers involved in the lead batteries waste management were the ones, and this is not new, but they really were the ones having high exposure to lead. Also, when we consider both kind of biological metrics, such as blood and urine, the same kind of results we get for the same group of workers. And I think this is an important aspect because if we want, it was possible to identify what was the waste management setting that implies high exposure to lead, what are the workers normally exposed to this chemical agent, and to reduce lead exposure, what are the priorities where the priorities for risk management should be applied. So where we should first apply risk management measures. So this is a way also to present. Again, this project was done in the different companies and different member states. Normally, each company is dedicated to a specific type of waste, but still, imagine that this could happen in the same facility. It will allow us to identify the group of workers with high exposure. In Portugal, we engaged a company in the HVM4U chromates project, and we also had a moment to communicate to the OSH managers our results. And in this case, we decided to use a table based on the one that used by the Risk Assessment Committee from the European Chemicals Agency to the applicants report their biomonitoring and air monitoring data. This is a simplified version of that kind of table to collect information. And we use these and different colors to communicate not only the exposure values, also an idea of the risk comparing with the biological limit value, but also trying to pass a message where the risk management measures should be applied first. Of course, in all these settings, there were already risk management measures applied, but the ones that, or the setting, the group of exposure that needs first an additional intervention, additional risk management measures were clearly the painting. So here we found that several samples after the shift or collected after the shift with values higher than the biological limit. That also happened in the plating group of workers, but clearly that happened only once. And indeed, in the painting group of workers, this was something to address in the future investments that the company were thinking on doing. Of course, we discuss and provide some explanations why these results were obtained. We had some ideas because we collect the samples, but we also spent a amount of time with these workers, understanding what they were doing and how they were doing things, what kind of risk management measures were in place, and what kind of improvements were needed in each group of exposure. So I think the lights or the kind of colors that we choose to present the data can also support the communication of the risk and the need of intervention. So, and here are some examples of sentences that we can use to communicate the results. So the SEG results are mostly lower or higher than the biological limit value. So we could use this, suggesting that current control measures are generally effective, or in the opposite, they aren't affecting controlling exposure. And these, of course, address the need of making additional investments. We can also use some results are elevated, so task-specific exposure sources should be reviewed. So the idea is to identify exposure sources that are present in the workplaces that can explain some of the results that we are getting. And for instance, in the case of painters, repeated exceedance of the biological limit value indicates that additional risk management measures are needed. And of course, a discussion could be on following, of course, the hierarchy of control and try to select the best option, or a combination of risk management measures. Sometimes the combination of different measures can have better results, but really this need to, or the results can point to this need, the need of continuing investment on risk management measures. So some take-home message, and of course I'm happy to clarify some doubts and discuss afterwards this presentation, but I think the most relevant message is this one. So biomonitoring based on similar exposure groups facilitates communication and supports the prioritization of risk management actions. This is done for air monitoring. So there is experience from the occupational hygienists defining the strategy for sampling when doing air monitoring, how they can present afterwards the information and how this can trigger action on risk management actions. So this is to do the same, but using biomonitoring data in an aggregated manner. Removing all the individual aspects, of course, that they need to be handled in a confidential manner. And of course, when the results are well communicated, biomonitoring becomes a practical tool for occupational health decision making. So it can indeed support the decisions for additional risk management measures. So its real value is better understanding, better communication, and better prevention and protection. So these are the main goals for using biomonitoring to communicate the risk. Yeah, and if you remember, I started my presentation mentioned a paper that we published in 2020. And of course, at that moment, we identified that biomonitoring was, well, it's an important tool. It can be very useful for occupational health. but well, it was not used extensively, and it can really increase. We should really increase the use of biomonitoring. But of course, we need to change something. We need to identify why it's not used more, and maybe the idea of using in a way that can facilitate the communication can increase the use of biomonitoring in this context of occupational health. So I think the idea was that to combine approaches well known, where we have experience on air monitoring, and try to bring it for the biomonitoring context. Yeah, and I normally say to my students that sometimes we don't need to measure. We really need to see people working and to try to identify the conditions where they are working. And here it's a photo taken a few years ago. It's a shaper, it's someone that is in the final process of doing surfboards. And as you can see, I really don't need to measure anything before recommending several actions to be taken to improve this workplace and to reduce exposure to chemicals. I think that is also an important message to pass. We really think on measuring is important, but sometimes we only seeing things can really help us to identify there is a need to change. So thank you so much for attending this webinar, and I'm happy to answer questions, doubts, and of course also suggestions for improving these approaches that are also very welcome. Thank you.